If you have thyroid or gut issues, fatigue, brain fog, then you'll want to learn about this simple blood test that can really help you. So my name is Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And over the last 34 years, after seeing over 100,000 patient visits, one of the most common things I see when I get test results back is this ferritin level being off. And what ferritin is, it's a storage protein for iron. So one of the things it represents is whether you have too much iron or too little. And why this is important is if your iron is too low, you can get symptoms like fatigue, weakness, difficulty concentrating, shortness of breath, hair loss, decreased thyroid hormone, decreased T3, and oftentimes it's involved with irritable bowel syndrome because when you have gut issues like IBS, you tend to have malabsorption and you don't get enough iron. Also, blood loss can cause this. Too little iron intake is the most common cause of it, and again, malabsorption. So a normal range, like when you get the lab results back, it'll say anywhere from say 10 to 150 female, depending on the lab, or 20 to 400 for men, depending on the lab. So that means you can have a result of say 10 and be considered normal and actually feel really terrible, exhausted, not able to think straight, a lot of weakness. However, the optimal range I find is between 60 and 90 right here. So that's where you're really looking for, because below that, you can really start to get some weakness. As a matter of fact, one of the most common causes of hair loss is low ferritin levels. So once it drops below 50, 40, hair loss can occur. So it can be really invaluable to know this. Now, by the same token, high ferritin level can represent iron overload. It can also represent other things, which we'll get into. However, if your ferritin level is too high, then you can also get very similar symptoms: fatigue, brain fog, abdominal pain, irregular heartbeats, diabetes, hypothyroidism, can be caused by elevated iron levels, and infertility. And infertility can be caused by iron overload and can also be caused by too little iron. So a lot of these symptoms overlap: too little, too much, and there's a whole lot of other symptoms and conditions as well. Now, what causes this elevated ferritin level is, besides iron overload, that can be due to hemochromatosis, which is a genetic condition. We also have chronic illness can cause that, like liver disease, certain anemias, even cancer can cause high ferritin levels. Excessive alcohol consumption over a long period of time, and insulin resistance is a common cause of high ferritin. So people assume that high ferritin level automatically is from iron overload. As a matter of fact, I did a video on this a little while ago where I saw a woman, a 64-year-old woman, whose ferritin levels were over 1,094. And she actually had, we did the genetic testing, and she had hemochromatosis. Even with that, when we did our protocol, she was able to lower her ferritin over 1,000 points in 4 weeks. So that is a really amazing improvement for iron overload disease. And the thing is, many, many cases of high ferritin, though, aren't from iron overload. It's from insulin resistance is a very common cause for that. So, and the way you figure that out is you really can't just do a ferritin test in and of itself. You have to check your iron levels, percent saturation, iron binding capacity, and your ferritin level to really get a true picture of what's going on, and not even that. So you really need to go beyond that. So instead of just asking your doctor, oh, can you run ferritin level? You want to say ferritin level plus an iron panel, which covers the saturation, TIBC, and iron. And you also want to get a CBC, a chemistry panel, CRP, which is for inflammation, lipids, thyroid markers, GGT, insulin. So and others actually, but you don't want to just check one little thing because you want to find out what is causing this. And almost everyone I see has either too little ferritin or too much. So it's really important to get a more complete picture. I did have a patient recently who had high ferritin levels and her iron was low. So, which is kind of like an oxymoron. So this ferritin was, let's see, her level was 316, which is about twice as high as it should be. And at first glance, you'd say, oh, she has iron overload. When in actuality, her saturation was low and her iron was on the low side as well. So what she did have though was insulin resistance, which is so common, metabolic syndrome, insulin resistance, which is a condition that also leads to obesity, eventually diabetes, and high blood pressure, which she did have, and she had a whole host of other symptoms besides digestive and fatigue and skin issues, high cholesterol, high blood pressure. So we put her on this program. The diet I like to use for these chronic health issues is, I call it the free diet, because it's free of not only gluten, but gluten, grain, sugar, yeast, dairy, eggs, soy, legumes, nightshades, and processed foods. So it's free of those foods commonly responsible for inflammation, digestive, and other chronic health issues. So we have her on that, and 4 weeks later, when we checked her blood test, well, not only was she feeling a lot better, more energy, digestive issues cleared up, her blood pressure dropped 21 points to normal levels, and her ferritin dropped in half down to 151 from 316. Her cholesterol dropped 61 points to normal. Her liver enzymes, which were elevated, dropped to normal levels by over 50%. And her inflammatory markers dropped by about 50% to normal levels. Hormone imbalance she had, so excess this ferritin, insulin resistance, which is what was driving her, is actually caused her to have this PCOS, elevated testosterone. She actually had infertility, required IVF to get pregnant. Before I met her, she had PCOS that was tied in with all this. So her testosterone was 70, which is almost well over twice normal levels, and hers dropped dramatically by, looks like, over 80% in 4 weeks. So it's amazing. What was the last thing? Oh, her iron actually, her iron was low and her ferritin was high. So her iron actually came up to normal. Like, even though we didn't give her iron, it's just amazing what can happen is if you start normalizing the body, give the body what it needs, and you take away the things that are causing harm. Like, for instance, we tested her and she had gluten sensitivity. She was sensitive and allergic to other foods. So just a matter of getting all those things balanced out. And we also gave her, besides the free diet, what I call the functional 5. That's a multi-fish oil, vitamin D, magnesium, probiotic. She was deficient in vitamin D, by the way, which is also common. And then we also had curcumin. And for people with iron overload, we add metal cleanse, either if they have iron or other toxic metals. liver support we used for her as well. If someone's iron deficient, of course, we use an iron supplement instead of metal cleanse. Also, if someone has iron overload, the infrared sauna we use as part of the protocol, which really works very well in excreting out excess heavy metals, including iron. So it's good to know that no matter what's going on with you, if you really hone in and get the right testing and find out what's causing it, then you can really be provided some solutions on how to get better, not just feel better, but actually get better. So thanks for joining me today. If you want a free copy of the Free Diet Phase 1 food chart, I'll put a link below for you to click on that. And if you want to subscribe to our channel, just click the subscribe button. This way you can get early notification of new videos. So thanks again for joining me today, and I will see you next time. Take care.